everyone, my name's Nyrah. I'm your GP pharmacist and host for today's health show on British Muslim TV. Now, in today's topic of discussion, we will be talking about healthy aging and what it's like to actually look after your health as you get older and why it's so important. Now, to talk about this topic a bit more in detail, we have a brilliant guest. She is a consultant geriatrician. Her name's Dr. Mucci, and I'd love to introduce her to the viewers. Hi, Dr. Elena. You.
Hi, hello everyone. Thank you for inviting me. I'm delighted to be here with you. Yes, I'm a consultant geriatrician and I have a strong belief in holistic, in-depth, full care of all the adults. So I'll try to answer all your questions today.
Brilliant. Thank you so much for coming on. I've got a lot of questions to actually ask you. It's a really interesting topic. I know, as it is inevitable that everyone's going to grow older as they get later on in life, and being able to take control over your health is so important. I think an initial question will be is, what is frailty and what are the common risks of actually identifying frailty as you get older? We hear the term, that lady or man is frail. What does it actually mean? Is there a definition of frailty when it comes to elderly care?
Brilliant question to start with, Nyrah. There is a total difference between the public understanding of frailty and medical definition of frailty. You are right. In the public, someone has to be quite obviously frail for them to say, my grandma is quite frail. Look at her. She is using a Zimmer frame, or she had a few falls and she had a few hospital admissions, or she has memory problems. But actually, definition of frailty in medical terms is different. And medical frailty, you might not see it with untrained eye. The medical definition is it's a state of vulnerability as an amalgamation of multiple medical problems you accumulate throughout your life, as well as age-related aging, as well as side effects of the medications you take for all these complex comorbidities and problems. And when you have a minor medical problem, it becomes very obvious that your body is struggling. Let me give you an example. You might have had a little stroke a couple of years ago. You might have high blood pressure you take a few medications for, diabetes, which might be affecting your vision, maybe your kidneys. You might have a little bit of nerve problems. And then that little tiny infection comes, whether it's a chest infection in the middle of the winter or urine infection. And then the deconditioning and the deterioration in your grandma or your mom is completely out of proportion. One day, mom was shopping, living independently, going and swimming, and next day, she has this UTI and she is completely non-functional. You take her to hospital and they find that actually things are not that bad, but she reacted in that way because she's frail and you didn't even know that she was frail. So that is why it's very important to appreciate that to be frail, you do not necessarily have to use a stick or have falls or have memory problems. You can be completely normally functioning older person in the community, and then you have that UTI and you are suddenly in hospital and you can't even walk.
That was a great answer, Dr. Mucci. I think the important aspect that you actually mentioned was it's more than just, having a walking stick or being on a bed and not being able to move at all. What are the general complications of frailty? So I know there are certain indicators you can look out for or kind of tools to actually monitor someone's actually going through frailty. What are the long-term complications, and why is it so important that we identify someone who is at risk of frailty in adulthood?
Crucial to identify frailty earlier. Let me explain to you why. If you know your mom or granddad are frail because of all the problems I've just explained, you can prepare for that deterioration. If you don't know and that urinary tract infection has come and you take mom to hospital, in hospital things only deteriorate. I'm a geriatrician and I'm telling you, if you can keep your parents, elderly parents out of the hospital, please do so. The hospital is the last place they need to be. Why? Mobility is going down. They go to hospital, they spend most of the time on bed, they decondition even more. So if you know your mom is frail, you know that when that UTI, urinary tract infection, comes, mom is likely to be off her feet, you can make certain preparations, whether the family looks after mom or whether you bring their friends and carers, or in fact, whether mom goes to a nearby lovely care home for a couple of weeks for convalescing. But try to avoid the hospitals. From my experience, Nyrah, about 70 to 80% of hospital admissions in older adults are not because they need hospital treatment. The treatments we are given can be perfectly given by the general practitioners in the community. They are in hospital because the families are not prepared. The crisis comes, mom cannot eat and drink, becomes confused, can't walk, start falling, and we take them to hospital almost to be looked after because the medicine's already there. They can be given at home.
So frailty, in that sense, it can be picked up early. And if you were to intervene early as well, you can actually reduce any future hospital admissions. And coming back to, complications of frailty, I know frailty is actually one of the leading causes of falls in the elderly as well. And falls is actually another leading cause of hospitalization. I think there were some statistics I was reading. 1 in 3 people over the age of 65 are likely to have a fall and be hospitalized. What are the other common causes of falls in the elderly?
The easy answer to that question is the falls are in the elderly always multifactorial. And that's important to appreciate because when you are coming to looking at the individual who had recently a fall, it's very easy. And our older adults are very clever at that. They try to hide it from the family. They get embarrassed about the fall and they will come up with an excuse as well. It's nothing to worry about. I tripped over the curb or I tripped over the carpet. Well, that's what we shouldn't ignore, those early signs. Because, well, Nyrah, I'm sure you haven't been going around and tripping over curbs and carpets, right, and falling. So there is always a reason, and the reasons are multifactorial. It could be muscle deconditioning. Maybe in the pandemic especially, people are locked indoors, they have cut down on their exercises, and of course, if you are an older person, you spend not moving for a week and the muscles start going. It could be the side effect of medications, especially blood pressure medications. You might have had several blood pressure medications prescribed when you were in your 60s and 70s. Well, the targets for blood pressure are different when you get into your 80s and 90s. We want your blood pressure to be a bit on higher side. And if those medications, they're not reviewed in a timely manner, you get into your 80s, your blood pressure is overtreated, that can contribute to falls. And of course, many other reasons as well.
Definitely, I agree. I think blood pressure is one of the most important contributing factors to falls in general. And it's actually really important. We actually monitor your blood pressure, as you get older. I actually advise a lot of my patients to go out, buy a blood pressure machine. So you do have it in the house and you can monitor your blood pressure when it's available. Why is it important to actually monitor your blood pressure when you get older? What advice or tips would you have for viewers at home?
So I have two-step approach. The first one is to realize that as an older person, your blood pressure targets are different. Let me give you an idea, and this has been recognized in guidelines as well. When you are 80 years and over, we want your blood pressure to be around the area of 150 over 90. Now, if you were a 60-year-old, that should be below 130 over 80. You might ask why such a difference, and I'll explain why. Because as we grow older, the blood pressure regulation ages as well, and it's so difficult to control the blood pressure. It goes all over the place. So when it goes down, there is not enough blood goes to the brain, you feel dizzy, and you might have a fall. That is why we try to keep the blood pressure on higher side. So when the blood pressure goes down, it doesn't go down enough for your brain to starve of blood and for you to have the dizzy spell. So 150 over 90 is general target in older adults. But if you are someone with a high degree of frailty or you have dementia, severe dementia, or you've been having recurrent falls, that figure could be as high as 160, 170. So that is why it's important to monitor blood pressure. All of you who are taking blood pressure medications, or your parents, please look where the blood pressure is, because it is possible that the time has come for us to take the medications back and cut down on those medications, so to sort out those dizzy spells and reduce the risk of falls. The second reason to document blood pressure is, as we grow older, we tend to have infections and diarrhea, vomiting bug, this virus, that virus, and of course, around the time of acute illness, you will not be eating and drinking properly, and the whole body is disturbed, and the blood pressure will go down. So it's so important to remember, we call it sick day rules, and as a pharmacist, you can talk about it more, Nyrah, about the sick day rules, when you have to monitor your blood pressure, and while your older parent is undergoing treatments or recovering from a latest virus, you might in fact stop the blood pressure medications for that period of time. Of course, all of this should be done through your general practitioner or your local pharmacist.
Definitely. Yeah, we will be touching a bit more about blood pressure and actual muscle wasting in the elderly. And as you get older, you are at risk of higher risk of muscle wasting. So Part 2 will be coming very shortly. We will be discussing a bit more about diuretics, how to actually take your water tablets, and also about Dr. Mucci and what she does in a day-to-day and what courses she can actually do. Now, if you have missed Part 1, you can join us again through Facebook. We have a live repeat. If you do have any topics or suggestions you'd like to share, feel free to message us using the number on the screen. Do join us again for Part 2. We'll be going more in depth about healthy aging after the elderly as you get older. Now, if you do have any questions, do ask via WhatsApp. And don't forget to follow us either on social media, including our page. Welcome back after the break. My name's Nyrah. I'm a GP pharmacist, and you are watching the Health Show on British Muslim TV. Now, in Part 1, I actually interviewed a great guest. Her name is Dr. Mucci. She's a consultant geriatrician, and we were talking about healthy aging and looking after the elderly later on in life. Can we reintroduce the guest, please? Hi, Dr. Mucci. I think it would be great to just kick back to Part 2, where we were talking about blood pressure in Part 1. So let's ask a few more questions. I think water tablets, a lot of patients are on blood pressure treatments. Some of those treatments include diuretics, so we call that the water tablets, such as indapamide. We have alternatives as well, such as hydrochlorothiazide, which is not really used anymore. What are the best tips you can give to someone that's on water tablets? Water tablets can cause a lot of complications, a lot of embarrassing complications, such as going to the toilet a bit too often. Are there any ways they can actually optimize on how to actually take their water tablets for their blood pressure?
Thank you very much for this question, because water tablets bring me a lot of frustration in my clinical practice, and I'll share with you why. First of all, if you're on a water tablet, you need to establish, do you really need it? And hear what I mean. Quite often, older people, as we grow older, the circulation in the legs is not that perfect, especially the circulation in the veins. And we develop a condition called chronic venous insufficiency, especially those of us who spend most of our working life on our feet. We develop varicose veins, and then the varicose veins lead to this condition, and the legs swell up. We develop ankle swelling as a result of that condition. And of course, you go and complain about it to your doctor, and you end up on a water tablet. That should not happen. The water tablet's usually there when you have a heart condition and your heart is not pumping properly, and that would be a clinical indication for a water tablet. But the other situation where I see water tablets prescribed inappropriately is if you happen to be given a blood pressure medication called amlodipine, or any other dipines, amlodipine, felodipine, nifedipine, one of those. One of the side effects of these medications is, guess what, ankle swelling. And you go and complain about ankle swelling and end up on a water medicine to treat the side effect of the other medicine. Frustrates me so much. So my first advice is, if you are someone taking a water medicine, Nyrah mentioned benzoylperoxide, indapamide, furosemide, bumetanide are the other ones in this group. Make sure that it's clinically indicated, that you are taking it appropriately. Now, if we assume that you are taking your water tablet for a good clinical indication, here are a few tips I'd like to give to you. Again, I have to come back to sick day rules. If you are quite unwell, a bit under the weather, on antibiotics for a recent infection or UTI, it's okay. You're not going to be yourself. You are not eating and drinking as you normally do. So it's okay to reduce the dose of your water medicine and maybe take it every other day, or maybe not to take it for a week, depending on the clinical indication. Discuss that with your pharmacist. But definitely I cut down on water tablets during the period of acute illness. Their second advice with the water medications is that to take it first thing in the morning, quite early hours of the morning. So they work for about 6 hours. The earlier you take, the quicker the water will come out of you and the sooner you can get on with your life. The third advice is so not to affect your quality of life so much, and you don't have to think the toilet all the time when you are out. It's okay if you need to go out to supermarket shopping. It's okay not to take your water tablet in the morning and take it as soon as you come home in the afternoon. Or occasionally, depending on your clinical condition, occasionally miss the water tablet. So these are my main tips, Nyrah.
They were great tips. I think you actually have a YouTube channel, and so if you have actually missed any of the tips that Dr. Mucci's covered about taking your water tablets, you can feel free to check out Dr. Mucci's social media profiles. I think water tablets are a big headache for a lot of healthcare professionals, but I think certain ways of taking your water tablet can create a drastic improvement in your actual response to taking them and your blood pressure as a whole. Moving away from medication now, so I know we both like taking holistic approaches when it comes to treating patients. Is there any other natural remedies you'd recommend to naturally lowering your blood pressure? Any tips you would give to viewers at home?
Well, I don't think that I'm going to tell you anything new here, but the very natural remedies, of course, weight reduction, stress reduction, exercise, and generally keeping active, and thinking of how much salt you are consuming. You cannot imagine how many people I cured their blood pressure problem just looking through their diet and cutting down a little bit on their salt consumption. And of course, if you have presented to your doctor with high blood pressure, that would be the first advice. We do not hand out the pills straight away. You will be asked to change your lifestyle, maybe reduce weight, exercise more, cut on salt, and only then, if your blood pressure is still high, we might consider going on medications. So these are the main advice, Nyrah. There is not much else to say in terms of the blood pressure reduction, in terms of natural way of doing it.
Definitely. I think exercise is one of the most important key factors here. You know, it naturally lowers your blood pressure and actually reduces your cardiovascular risk in the future. I think even if you did 30 minutes of walking a day, it would make a huge difference. And just moving on. Yeah, sorry,
I
go
just
ahead.
wanted to say, while we're on exercise, I just want to squeeze in and to share with you that exercise also has shown to reduce or postpone the onset of dementia. If you look into all the dementia, which is the memory problems, if you look into the dementia research, to date, we do not have any remedy, any cure for dementia. But one research after another shows exercise, keeping active physically and mentally, can postpone the onset, the beginning of dementia, or in fact, in some individuals, even to even prevent it.
A very interesting link between the two, actually. I'll definitely do some research into that later on. And whilst we're on the topic of exercise, as you know, people get older, muscle wasting is a really big problem. I was looking at statistics before the show, and they said as you get older, I think over the age of 30, you can lose up to 3 to 5% of your own muscle loss, and you start to be getting all those muscle aches and pains. You know, are there any risk factors which can actually worsen muscle loss as you get older?
That's right. There is a medical term to muscle loss, sarcopenia. It's something which we cannot avoid as we grow older. There is a muscle loss, and to prevent that, you need to keep active. Now, let me give you another statistic, Nyrah. Do you know that an older individual in hospital bed for 1 week will lose as much muscle as you would lose if you are in hospital bed for 3 months? Wow. That's how quickly the muscle goes in older adults. It just disappears. And oh my God, I keep talking as a geriatrician whenever I'm going on a ward round, and if I'm seeing a patient in bed, I say, get them out, get them moving into the chair. Of course, not coming to hospital is the first remedy. Another piece of research showed that 96% of the time, if you are in hospital, you are spending in bed or in chair, you are not moving. And that can't be helped. That's a system in hospital. So if you do need hospital treatments, that shouldn't be more than 2-3 days, really. And then we have delays in discharges because of miscommunication and social problems, and people are stuck in bed and losing the muscles. So one way to prevent muscle wastage is never stop moving. And even if we are, God forbid, in another lockdown, just get into your garden, get into your neighborhood, walk, walk, walk. And you, of course, can get devices. You can get the bike or maybe a pedal thing indoors, and just keep moving those muscles.
Brilliant points. I think, yeah, keeping moving, being in a hospital bed, so many complications, as well as just the actual reason you're admitted. And any tips you could give to viewers about actually helping with their muscle growth? So I know you have the exercise. Is there anything, you know, over the counter that they can get to help improve with their muscles? Would you recommend any supplementation? You know, there's so many things online now. Dr. Google's out there. So many different sources as well. What kind of supplements would you recommend anyone to actually taking as they get older?
The evidence is for vitamin D. So we can't really help the growth of the muscle. The only thing which helps the growth it's exercising. But vitamin D supports the muscle, and in clinical trials it has shown in with or without calcium can prevent falls, can prevent fractures. So there is a strong evidence for vitamin D. And of course, let's remember who are at risk of vitamin D deficiency. All the people, those especially in care home environments who do not go out on the sun enough. But let's not forget, and especially being on a British Muslim TV, let me remind you guys, if you are in fact Asian person or Afro-Caribbean people as well, anyone with a dark skin stops their ultraviolet getting your vitamin D metabolized. So Asian and Afro-Caribbean people are particularly at high risk of vitamin D deficiency. Let's not forget some people wearing clothing covering because of religious reasons. So a lot of vitamin D deficiency in that population, and then younger ones present with aches and pains, and the condition is called osteomalacia, and you check their vitamin D levels and they are non-existent, and older people present with falls and fractures. So make sure that you, if you are at risk, make sure that you've checked your vitamin D levels, especially if you have other medical conditions and you have either over-the-counter supplements you buy in the local chemist, or if your levels are really low, you actually need a high-dose treatment through your general practitioner. Talk to your GP or your
Sorry,
pharmacist.
Dr. Mucci, we are coming towards the end of our show. I know we talked about so many different topics and we can just go on and on. It's been really useful discussion. I'm sure the viewers at home can agree. Join us again next week when we will be talking about a different topic of discussion. Thank you so much, Dr. Mucci, for coming on the show. If you do have a chance to actually watch us, feel free to check out our Facebook page and join us again to talk about a new topic. I'm your host, Goodman.